Hi, Nat.
Hi, Christina. How are you?
Good. How are you doing?
I'm doing pretty good. Thank you. Thank
Uh,
you.
Thank you so much for taking the time to chat with me about what's going on at Neighbors Together. For those of you who do not know, my name is Christina Singh, and this is Nathalie Smythe. And I am the Development and Communications Manager with Neighbors Together. And Nathalie, feel free to introduce yourself.
Sure. My name again, Nathalie Smythe, and I'm the Director of Programs and HR at Neighbors Together.
Awesome. So as a lot of you know, Neighbors Together has gone through a huge transformation over the past 2 months, really, due to COVID-19 and this pandemic. We, in mid-March, decided to go to-go meals, and the rest of our staff, have been working remotely. And so with all of these changes and with everything you're hearing right now, we wanted to get online and talk to you about what is happening at Neighbors Together and what exactly we're doing and what our members are facing, what we need right now, just to be totally transparent with the situation here in Brooklyn and in New York City and what we're going through as an organization. Because there is so much happening around us, and we've had to adapt very, very quickly, like many other organizations. So I wanted to talk to Nathalie about this and see, what she has to say, since she's our Director of Programs and HR, and talk to her about these changes. So kind of first, just to dive in, Nathalie, can you talk about our cafe setup before COVID-19 and how we structured meals, and the work that we did in the cafe and in our empowerment program, our social services program?
Sure. Yeah, definitely. So pre-COVID, Neighbors Together has been offering hot meals Monday through Friday, twice a day, lunch and dinner. And we've been honestly providing meals since for over 37 years. Pre-COVID, we have like we had at the time like a sit down dining area where members were welcome to come in and congregate and eat meals together in a very communal and very familiar and friendly environment. Meals were prepared by our team, our chef, our lead chef, Chef Marcel, um, and with the assistance of other staff as well as like temps and volunteers over the years. And yeah, it was very much your soup kitchen experience, just with like a more positive swing in a great environment. The meals that were served were like hot and ready, nutritious, delicious, really good. We, as you've probably seen on our social media, we're glad to showcase what our chef has been doing, providing these great meals for our members. So yeah, in the cafe, that's the way it was for quite some time. In the second program, the empowerment program, we have a team of 3 who were on site, and that included a member advocate employed through our partnership with Avodah, which is like a Jewish core program. The core member would actually provide an array of services, everything from housing to filling out tax forms during tax seasons to like resumes for those who are like looking for employment. Just almost anything the member advocate would do on on a consistent offering those services Monday through Friday. In addition to those services, he or she would run a weekly group where members would be able to kind of gather in a setting to kind of discuss like current events, what's going on in their personal lives, engage in an activity like crafts and arts, and watch films together, do poetry. It was something that we were able to offer our members, and they enjoyed in the space on a weekly basis. In addition to the member advocate, we also have a full-time supportive housing specialist, and that's Marlon. Actually, Marlon, he has been working at Neighbors Together for about two and a half years now. And what he does specifically is help members who are suffering with a severe and persistent mental illness. So illnesses such as schizophrenia, bipolar, PTSD, major depression. If those members are suffering with an illness and are at risk of homelessness or are homeless, they could qualify for housing, for safe and affordable housing through the supportive housing network of providers that are available in our city. And so he would engage members in the application process, which could take anything from 6 to 9 months to even a couple of years. There are many reasons why it could take so long, but it is a long process. And Marlon or the specialist would actually help members fill out the application, gather documents that they would need to do the work, and to submit for approval and for interviews. Will also help with like looking at vacancies that are available, support them in the interviews with the housing providers, and advocate on their behalf for placement. And lastly, part of the team consists of, there is a housing advocate. So as I mentioned, it's supportive housing, but there's also those who are not suffering with mental illness, who also need housing as well. And so we were very fortunate last summer to hire a part-time housing advocate on site. Suzanne, she has been the one to basically help people like apply for affordable housing, look for housing that's available, according to their budgets, whether they have a voucher, a city or state voucher that could qualify them for housing. She would work with them to find the housing, get them interviewed, submit the paperwork, and get them into those apartments.
Yeah.
So that sums up the 3 members of our empowerment program. That's what it looked like pre-COVID.
Before COVID. So
yeah.
As you heard, we have a very robust program in our cafe and in our empowerment program. And a lot of the work that we do through those 2 programs, and our 3rd program is our community action program. And we're going to save talking about that program for another interview because it deserves one massive interview.
There's so much.
There's so much to talk about with our action program.
Yeah.
But in our community cafe and in our empowerment program, so much of our work is on site. We are serving meals every single day at Neighbors Together. We're meeting with members every single day. In our empowerment program, I don't think, our staff was really used to traveling kind of everywhere. Everything was really more of a hub at Neighbors Together. Not that they wouldn't, for various reasons, but just to give people an idea of how big of a shift this has been for our organization. Can you talk about how things are looking now during COVID-19 and the measures that we're taking now to protect our members, protect our staff, ourselves, families, everyone?
Right. So since early March, when we first started having conversations about next steps, one of the things that we knew for sure that we had to close our space eventually. If the city was going to go quarantine, we knew we would have to. However, we knew that we were providing an essential service to a population that even pre-COVID were often overlooked, just for their basic needs to be met. And so we knew that, okay, if we had to close the facility, how can we still connect our members to these services? How can we still help them get meals and housing, whatever it is that they need? We did not want to disconnect from them, even though we were physically apart. Right. And so we were able to make some changes so that we can still protect our staff while providing a lot of these essential services. So in the first program, the Community Cafe, as I mentioned, we have a team of 3, and they were the ones who were providing meals like Monday through Friday, twice a day. We have made the decision, however, to reduce the number of meals or the times that we would be open from 2 meals per day to just 1. So now we are only open from 12 to 2 to the public for meals. And so even though we're not able to serve in the evening as we did before, we're happy that we're still able to provide something at this point. A lot of people ask, well, why is that? Why are we not doing the 2 meals? Well, simply because we're also keeping in mind the safety of our team. We have a small team, and to have them commute to Neighbors Together and to spend like extended periods of time every day wouldn't really be wise. It's something that we are very mindful of. We want to limit how long they're in the space, and because of that, they're not working Monday through Friday. They're on rotation. So between the three of them, they're working just a few days a week, 2 or 3 days max a week, and for shorter period hours in the day, where they would just come in early enough to receive a few temps who are working on site with us or volunteers, prepare the meal, and send out immediately so that they are out of the facility at a decent time, back home and safe with their loved ones. And so that is the compromise that we have made in the cafe. We've also decided if anyone knows anything about Neighbors Together, we rely heavily on volunteers. And so we have been very fortunate over the years to acquire and get amazing volunteers from our neighborhoods, our community, within our membership. And we've decided, for their safety, because many of them are also at risk. Many of them had like physical health concerns as well. And we decided to refrain all member volunteers from volunteering in the space during this time. We wanted them to remain home and safe, but they were always welcome to come and receive a meal since we're still serving, but we just wanted to limit the number of people in the space as well. Right. And so we have been very fortunate to partner with Human Resource Administration and Department of Social Services to acquire temps that they would pay to come on site and also work about just a couple hours for 2 days a week. And so we will have a consistent flow of people who are working at Neighbors Together without having to have too many new faces, in our space. So we have a small team. On any given day, you would see at least 2 or 3 total. That includes a staff person and 2 temps who would be on site to help with the meal. And again, we want them out at a decent time, safe, to get back to their families. And so that's some of the decisions we've had to make in regards to the meals. We still continue to partner with Rethink. Rethink is another nonprofit, and what they've been able to do is acquire meals from restaurants and help us to subsidize the meals that we're preparing on site to make it a lot easier for our team as well. So they come a few days a week. They give us hot meals, cold meals that we will either reheat, and they would have prepared, and we just distribute those meals to the public.
Can you talk about how our team is getting to and from Neighbors Together right now?
Yeah, definitely. So still on the safety protocol. So one of the things that we knew was we did not want our team catching the trains. We did not want them catching the buses, getting on public transportation. They were already taking a risk every time they stepped out of their doors, just to come to Neighbors Together. We knew they were taking a risk. And one thing we wanted to do was to ensure their safety in their travel. So for one of them, they were able to get an e-bike to get their traveling about a good 8 to 10 miles, on an e-bike to Neighbors Together on the days that he's scheduled to work. Again, it's just better than we were doing Uber for a while, but the e-bike's even better. He's able to have his safe stored in his home. He comes out, he brings it into Neighbors Together, it's not even staying outside. And he's able to work and travel safely. And secondly, we have an amazing board member, Anna, and her husband, Tim, who have been so gracious to loan us their car. They are quarantined. So they just say, listen, we're going to help, take the car, take it. And it is an SUV, which made a huge difference for us. So our chef Marcel has been able to take the car and travel from home and back. And because it's large enough to carry food and equipment, he's also using it to make runs to Jetro, a cash and carry for food and supplies. He's able to get things in bulk and bring them to Neighbors Together. And so that's been another way that we've been able to kind of protect our team as they're traveling, which has been amazing. We're so grateful.
Absolutely incredible donation, and board member is amazing. And I just remember when I heard about that, my jaw just dropped. Okay, great. And can we talk about the safety precautions that we're taking on site and everything that we're doing to make sure that on site, we're okay and our members are okay and the space is clean and our meals are really great and clean.
Right, right. So, pre-COVID and even during COVID, we have always reinforced Department of Health protocols, which is like the washing of the hands, use of sanitation, eliminating cross-contamination, with the use of gloves. And so we're just reinforcing that during COVID. In addition to that, we are, we do have masks. Everyone on site is wearing a mask. We have been very, it's been awesome to work again with other board members who were able to get us masks like by the bulk for us to use for our team and also to distribute to the public. So between like gloves, masks, we encourage, we also have like jackets and aprons that we give to the temps and the volunteers who are on site to just kind of reinforce the CDC guidelines of social distancing, as well as like sanitizing and good hygiene practices. So definitely lots of washing hands, lots of use of sanitizers. I know their hands are ashy from all the soap and water, but
I think everyone's hands have aged like 80 years during this whole process.
Exactly. So yeah, we're definitely keeping that, putting that in place on site to protect our team.
Great, wonderful. And I know you mentioned Rethink and you mentioned Jetro and how we're still going to get food, and Marcel is doing such an incredible job at making meals right now. Can you talk about what our meals look like right now and where we're sourcing that food? I know we talked about those two options, but I think it'd be great to talk about where we get our food and specifically right now how that's maintained or changed and what we might need.
Right. So, historically, we've always partnered with the Food Bank of New York City. So we were fortunate to still have some food, like dry goods on stock that we were able to use. Our pastas, some of our rice, our oils that we've been able to use in our kitchen. We also still receive goods from City Harvest. They still come by on a weekly basis, which is great. Those goods include like breads, vegetables, like a lot of dairy products like yogurt, some fruit that we're able to include in our meals. And so with those food sources, in addition to paying cash for other items, we've been able to prepare meals. The chef has done some really good meals. You probably have seen like the roasted chicken and the French fries and the salads and the pasta dishes. I just gained weight just looking at the pictures. So it's
Marcel will text me photos and I'll be like, I'm so hungry now.
Yeah, I know. Exactly. So that's where for right now where we've been able to get a lot of our food. We are actively looking for ways to get some more like already prepared meals, like meals to go on site, so that we can distribute those as well in addition to whatever's prepared. We would like to be able to increase the number of meals that are going out to individuals. Right now, it is one plate per, or one box per person, one hot meal. But we're trying to figure out ways to increase that in a way that's still considering like our current staff capacity. We want to be able to be realistic, but we do see that there is a need. There's definitely a need, and I can say that simply because pre-COVID, on average, we were serving anywhere between like 150 to 200 meals, per meal. And now it's like pushing like over 200. In some cases, it's been like 300 in just 2 hours, which is kind of like insane. We hear it. We hear that unemployment has gone up, like not just in New York City, but across the nation. But to see the demand, people are coming and looking for hot meals. It's heartbreaking and it's a reality, and we want to be able to continue to do that, but we have to just be mindful of current staff capacity and what we can do, to make that happen.
Of course, and I mean that segues into what I wanted to talk about next was what we're seeing. Our meals, like you said, on average it was 150 to 200 meals a day, and both you and I are now getting the daily meal count from the cafe team, and it's always been consistently over 200 recently, and sometimes 300 like you mentioned. So as you mentioned, there is that need. Can you talk about what we're seeing from our members right now? And I know we're talking about an increase of people coming to us. I know we're actually, as an organization, expecting an increase for quite some time after this crisis
Right.
subsides, given whatever just sort of parameters we have as a state where we're getting back
Mhm.
to somewhat of a normalcy.
Right.
But
Right.
can you talk about what we're seeing right now from our
Mhm.
members?
So yeah, so like you said, in addition to like an increase in the number of people coming in for meals, we're also noticing that members are coming in without PPE, without like proper, protection equipment at all. We're noticing that they need gloves, they need hand sanitizers, they need like soap, water, they need masks. They need them. Some have been able to make some with like, bandanas and other pieces of cloth. But just as a reminder, if people don't know, again, we serve often the underserved, and many are coming from shelters, many are coming from the streets, many are coming from three-quarter houses, and they do not have access to washer machines all the time. And so, uh, just to get, just to be able to provide disposable masks is something that we want to be able to do on a regular basis for our members. So we're definitely seeing a need for just hygiene products
Mhm.
to distribute for our members. I also like what again, we've also been able to, as I mentioned, we've been working with a few temps that were hired through another agency. There are more people
Yeah,
who are looking for work, people who are, lost their jobs and who are going to need, there's no guarantee that their former places of employment are going to reopen.
right.
Um, so, and people are just looking for resources. They're looking for, another thing that we're finding is that there are some who are trying to get who need food to be delivered. They know others who are homebound. So there are some members who are asking, like, okay, I have other people that I want to be able to feed, or there are other people that I know, but the little old lady like down my block, she can't make it. We don't want her to come out. We're seeing a need for a delivery service as well, and it does, just so you know, it does exist. There is a delivery service right now for pantries and excuse me, like I know in Brooklyn, we recently heard about a program called Best Side Strong, which is like an amazing collaboration of Brooklynites who are like purchasing and getting like groceries for their neighbors. But in regards to receiving hot meals, we currently need something for Neighbors Together to get our meals out there to those who are homebound.
Yeah, we've talked about, three things so far that there's a need around. Pre-prepared meals
Hmm.
we could utilize to continue to distribute to folks, and have things be a bit more balanced. The PPE for members, because we are seeing our members come in without masks and gloves. And just so you all know, we do, I think Nat mentioned this before, but we do have social distancing practices in our line outside, and we enforce that for our line outside as well. But that's another need. And then the third need you mentioned is help with delivering food to more elderly members or people who might have disabilities and people who are very, very vulnerable and who are experiencing food inequity right now. And then I know, kind of going along with the PPE, we've talked about sanitizer and things like that. So is there anything else that we need from the cafe perspective, besides those things I mentioned? I know obviously our costs are increasing at Neighbors Together. And can you talk about that a little bit, about what that looks like?
Well, yeah, we're now having to spend money on items that we didn't think we needed to before.
Yeah.
And they are pretty pricey. Like, for example, um, you know, recently, earlier in the year, or actually it was last year, last summer, it was passed that like styrofoam containers, we had to move to like more biodegradable or environmental containers. And now that we're doing only to goes like every day, we were only doing to goes maybe like once a week actually pre-COVID. But now that we're doing it with every meal, that means having to purchase a lot more of these containers. you know,
They're not cheap.
they're not cheap. Definitely, they're not cheap at all. So that's definitely a cost that we have seen that has been increased. We have been fortunate to get some donated, but we're still also having to supplement what's been donated by purchasing out of pocket for those containers.
Yeah.
That also means the cost for like more utensils, again, because the numbers are increasing. So we have to pay for more forks and napkins and knives and spoons. So that is definitely an additional cost. Now that we have the car, like gas and maintenance, like it's like expenses that we didn't have before, and now we're seeing in our space. And also because of like hygiene products and things like that, we're looking into like what it would cost. Like we know that about like I think like $5,000 would get us like maybe like 1,600 like hygiene kits. That again, if you do the math of like 200 meals or 300 meals a day, that's gonna be gone in like 2 weeks. Like it's so just like we're needing a lot of items, and it's going to cost, because it's not like there's not like a tree where you can just go and grab like hygiene kits or or get these
And
get like
the
containers. It doesn't exist.
yeah.
So we have to be able to pay for that out of pocket. If it's not donated, we have to pay for it.
Absolutely. And the supply right now for these items has increased exponentially. And so
Yes.
our wait time when we're purchasing these items can be significant. And so we really do have to plan ahead and
Mm-hmm.
be able to order these items much, much, further in advance than we would have before.
Yeah.
So if you are watching this and you're interested in supporting our work and interested in helping us serve these meals and getting these, 200 plus meals out in 2 hours every day, you can donate to Neighbors Together. We do have a COVID-19 relief fund, and you can head to our website, neighborstogether.org, and just go to /help. And that is our relief fund. We've had so many wonderful people donate already, and it really does significantly help us during this time. And like we mentioned, for that extended period after this all hopefully calms down. But thank you so much for outlining what that looks like.
Yeah.
And I want to dive into the empowerment program now and
Right.
talk
Mm-hmm.
about what our social services look like, because so much of our work in our 3 programs, they just, naturally fall into each other, which is why we have this holistic 3-program model.
Right.
But when we touched on how our empowerment program looks and how it looked before COVID-19,
Mm-hmm.
what our staff was doing, can you talk about our current setup for our empowerment program?
Yeah, definitely. And so as of right now, our entire team is working remotely. So they're all like either like at home, not even this summer, not in the state right
Yeah.
now. And they're working remotely. And so they have like the phone numbers, like, and if anyone needs any service, you can still call the same number. You will still find the team at the same extensions. It's just they're not providing the same face-to-face contact that we were able to do when we were on site. So just to give a visual to what Neighbors Together looks like physically, when you walk in through our main doors, you walk into a cafe, and right to the left is like a little like ramp and an entry to our offices. And so our member advocate Miriam, our supportive housing specialist and our housing advocate, we're literally like a yellow away.
Yeah.
Like, hey, I need to speak to so and so, and immediately like they would be able to be face to face to someone and to answer any questions, direct them in any way that they needed, resolve any issue that they had. And so we were very forward facing, like engage with our members, so with anyone who needed help. Now it's a little different. It's being remote, not having someone that you can go to directly has been difficult for our members. As you can imagine, Neighbors Together is not the only place that has been closed in this capacity in regards to services.
Right.
So we really want to let the public know that we are still here. Even though physically we're not available, it doesn't mean that we're not happy to get on the phone call or send an email or whichever way is easy for you, or even text, if you need to communicate that way, to kind of help you navigate our city and the resources that are available during COVID. So again, the phone numbers are still available. Our member advocate, you can still find her at extension 5007. You can call, leave a message there. She will call you back, within like 24, 48 hours, as long as you're not calling on the weekend, but she will call back.
Right.
And just answer your questions and just, provide support. Our supportive housing specialists and our housing advocate, they're still looking for vacancies. They're looking to see what's available. They're available to help fill out the applications for supportive housing or for affordable housing, or just to see what you can get with the voucher. They're still active. They're still available and actively doing that for our members. They're also like following up with members that they've, had to kind of like may have needed to like suspend services because, let's say, they needed to physically go to an interview, to a viewing of an apartment that's on hold, as you can imagine right now. But they're still calling members just to check in to make sure that they're okay, in the meantime, that they have what they need, and while they are also waiting for the city to, reopen. So yeah, our team, they're still available. They're still working. They are, doing whatever is necessary just to make sure that our members are receiving what they need. And even though they're physically not in the space, they're also making referrals, letting people know what is available closer to them where they do live, if they're in a shelter, wherever they are in the borough. So they don't even have to come to Neighbors Together to get connected to someone. We're happy to make referrals to other nonprofits, other community-based organizations that are closer to where they are, so that they're able to, get those needs met. So definitely they're still doing referrals and they're doing what they can, like online.
Great. Thank you for that.
Yeah.
And I know that we've talked about this as a staff, but the housing process, supportive housing, voucher holders, what have we been seeing since this crisis has unfolded? And what are we hearing from officials versus what are we seeing?
Right. So I think it's important to say that pre-COVID, Neighbors Together has been focused on housing for quite some time.
Yes.
There's always been often a lack of affordable housing, real affordable housing for very low income New Yorkers. There's barely anything out there. It's very difficult to find, and it's not easily available to our members who are on fixed income. And for quite some time, I don't want to go too much on this because I know that my colleague Amy will touch more on the campaign work. But for quite some time, we've been calling on our elected officials, to make housing available. Making affordable housing available for our low-income New Yorkers. So those who are on SSI, those who are, working on minimum wage, whatever the case may be, like we just needed something available to our members. So even now, during COVID, as you can imagine, like looking for housing, people are still there. If you look, there's still apartment viewings going up. There's still apartment viewings going up. There's still like housing, like on the market is still going up. But we do know that we do not want to send our members anywhere at this time because of the virus. But and even though they're like virtual tours available, we know like no, we need members to have the opportunity to go and check out these spaces for themselves. And what we have been able to do in regards to supportive housing is still have some of our housing providers do interviews over the phone, which has been helpful. The interviews over the phone has been able to help some of our members obtain housing, even though they physically cannot yet move in to the space. They have been approved, and so we're just waiting for the opportunity for the doors to be open again so that people can get their keys and move in. So with housing, overall in New York City, it's hard. Has always been difficult. Even if you can afford it, it's still hard to find like a decent apartment in New York. But now it's even more difficult. It's even more difficult for our members to get housed, and as you can imagine why. There are various reasons why.
Well, thank you for that. I before we wrap this interview up, and thank you so much for your time again and for talking to everyone about what's going on together. I want to talk about the city, state, and federal response to nonprofits right now. We are so fortunate that we have had a number of foundations reach out to us and offer support during this time, offer applications for support. There are so many funds that we've been able to apply for and qualify for, and support that we're getting right now, which is absolutely incredible. But one thing that we have noticed that has been lacking, and you can speak to this on the cafe side, has been emergency assistance at the city, state, and federal level. And one thing that we've noticed at Neighbors Together is we have had to create a plan for ourselves and to provide emergency relief to this Brooklyn community. We are at the epicenter of this pandemic, this global pandemic, and we have not heard anything from the city, state, or federal level, as far as I know. But if elaborate that as far, as our cafe goes, and kind of what we are hearing right now.
Right. Just to be fair, I would say in regards to the city level, like with some of the agencies, specifically like HRA and DSS, they have been able to help us get the temps on site, which has been great. However, overall, I think what happened was there's such a lack of preparation, from our governmental officials going from the federal government down to when COVID was announced, and that it was a national concern in our nation, that by the time it was announced, if I recall, I believe it was like a Sunday, that it was announced to the public, de Blasio announced that the schools were going to be closed the next day. And I'm like, okay, like how do like, with no preparation, nothing. It's just like, oh, we're closed, And I think what had happened was that, what it seems like to me, it seems like a lot of our officials, unfortunately, if certain things were never taken care of pre-COVID, it's very difficult to put a plan during COVID.
Right.
If there was never a plan to help people get out of the shelters, if there was never a plan to make sure that people were getting access to like healthy foods, that was like nutritionist and really good, like good quality food, if there was never really a plan beyond the efforts of a lot of nonprofits, churches, community-based organizations who are many of them are volunteer based. They're not even getting funding a lot from the city or state to operate. Yes, there's funding for food, specifically like, the Emergency Food Assistance Program, or TFAP, or like the grants through HIPNAP, which is nice. However, to operate and to make into the administrative cost is very limited, and in some cases like non-existent for a lot of nonprofits. So the nonprofit world, when it comes to specifically like the homeless and those who are facing or dealing with poverty, our government system really never had anything in place or anything in mind. So when you think about COVID now, I'm not surprised that there wasn't a plan. It's not in them. Unfortunately, it's not in the make of our society and our culture to say, let's look out for the ones who don't have. Let's figure out a plan to figure out why don't they have? What is wrong with our systems that people are homeless, that they're choosing to sleep on the trains. What does that say about our shelter system? No one's having that conversation. It's not a priority. So now that you're dealing with COVID, of course the response is, well, oh, this is disgusting. We got to get people off the trains, and you begin to criminalize people who are just at a disadvantage, who just need some assistance. They're not looking for a handout. They're looking for an opportunity to do for themselves. So yeah, there's really nothing much they can do now if it was never taken care of before. And unfortunately, what COVID did is just simply emphasize or highlighted or exasperated the problems that always existed in our city. It was always there. And now you're forced to see it. You're forced to see it now because you see the lines. You see the lines of the soup kitchens. You see more of the lines of the food pantries. Why are you seeing it? Because you're not at work. And this is now, you're now walking down the block, or, you're walking your dog with your mask, and you now notice that there's a soup kitchen here. Like, oh my God, I want to help, which is great. Like people are responding, and they want to make a difference. But it was so easy for so long for it to go ignored, and I think that has been the case at the fault of our government. and it's the reason why Neighbors Together does a lot of grassroots organizing work. We're constantly like yelling, we're here. Like we are here. Like
Yeah.
we need you to, and we're not looking for you to give us something. We need you to change the system, change so that everyone has an opportunity to just meet their basic needs. You know, we're not asking for everyone to be like in a luxury apartment in the sky. Like that's not what we're asking for, but to have a clean and safe space where you can lay your head and not be terrified about being evicted, you know, like the next day, or being mistreated. That is what we've been yelling at for so long. You know, we've been asking for so long, raise the minimum wage to living wage, you know, and by the time that they do, rent goes up even more in New York City. So now the living wage is a joke, you know, because again, people that have been ignored were always ignored. And now during COVID, it's like, there's no plan. And I honestly never really expected a plan, because, and that's, I think it's the reason why there's been so silent, or why there's been such a resistance to making some changes around the systems that are in our city. And so you may hear now about some, you know, there's talks now like, oh my goodness, like we need to do X, Y, and Z. Like you might now start hearing those things, and we're just like, yeah. Like you're right. You're absolutely right. Let's get affordable housing on. Let's get people out of the shelters into some isolated units. Let's get them into the hotels. They're all empty anyway. You know, like you're now hearing that response, and we've been trying to say that forever.
Yeah.
Forever.
Yeah, no, you're spot on. Thank you for that.
Yeah.
And
Yeah.
one of the mission of Neighbors Together is to end hunger and poverty in
Right.
3 of the lowest income areas of New York City, Brownsville, Ocean Hill, and Bedford-Stuyvesant. And the reason why it is now end is because we know that there has to be a systemic change. We've known this for so long.
Right.
We know that there has to be real tangible change to the systems that are keeping our low-income neighbors in these positions where they continue to be in the most vulnerable spot when it's not necessary, and when we can change that, when we can provide assistance at these levels for our neighbors. And it is disappointing that we have not heard about major relief efforts or support for emergency food programs. We are having to raise these funds. We are having to execute these meals, our social services, and advocate for more. And it is really horrible that during a pandemic, we are saying we're not surprised that we and that we're saying, unfortunately, this has been how things have been on our end for the population that we serve. For quite some time. And again, we will be talking with our community action program about dive into these subject matters. But if you are not following us on Twitter, please do. We are part of the Homeless Can't Stay Home Coalition, which has been formed in the face of COVID-19 and the ever-present danger of people living in congregate shelter right now and not being able to properly social distance, and people who are living on the street who are choosing to continue to sleep on the subway, like Nathalie said, instead of move into a congregate shelter where they're very much put at risk. So you'll hear a lot more about that, but please follow us on social media. We are on Facebook, we are on Twitter, we are on Instagram, and we really do try and keep everyone as updated as possible about our work and what we're doing daily, because we have been here, we have been doing, we have been talking about these things, and addressing the fact that these needed to change in the first place. And what COVID-19 is highlighting is the systemic inequity, particularly for low-income communities, Black and Brown communities, and what they have been facing, and why they are dying in such exponential numbers during a crisis like this.
Definitely.
It doesn't need to be happening. So, thank you so much, Nathalie, for outlining what we're doing at Neighbors Together and how we've sprung into action and how we're continuing to provide our services and trying to stay safe while we're doing so. You know, I think, again, I want to plug our website and our relief fund. It's neighborstogether.org/help. It is the best way to support our work right now. besides, getting us in touch with prepared meal delivery services and people who could deliver to elderly folks at Neighbors Together, and then donations of PPE and gloves and masks and hand sanitizer, really supporting us financially will enable us to buy those things. And
Right, right.
anything you want to mention before we wrap up?
Yeah, I just basically wanted to say thank you so much to our volunteers. Like there, and not just for Neighbors Together, just like across the city, there are thousands of New Yorkers who have stepped up in so many ways, to really like alleviate the damage that COVID is doing in our communities. They're working so hard with the resources that they have. The networks that they have. They're sharing information. They're raising funds. They're getting donations in the various nonprofits and emergency programs across the city. It really tells you how much that the heart of New Yorkers is that they really do care. They really do care. And I think we're just waiting for that to be echoed or translated through our government system, our laws that we put in place. We want to see that translated to something that's more permanent and like in writing legally, because the truth is people do care and they really want to see their neighbors do well and have their needs met. And so I just want to say thank you to everyone
Yes,
for just stepping up right now.
Yeah. 100%. Well, thank you, Nathalie, for your time.
Right.
For talking
Thank
about
you.
and we will be back hopefully next week with another one of these, and hopefully actually live, so we aren't having issues. But thank you all
We'll
for
figure it out.
tuning in. And we really appreciate all of your support. And to those who are spreading the word about Neighbors Together, please keep doing so. We really depend on you all to keep doing this. So thank you so much. And thanks, Nathalie. I'll talk to you soon.
Thank you. Yes, well, have a good one.
You too.